Thank you, Mr. President and members. I have the A19 amendment.
1-5.
1-9. A19, Mr. President.
Senator Murphy offers the A19 amendment. The Secretary will report the amendment.
Senator Murphy moves to amend House File Number 2128 as amended pursuant to Rule 45 as follows. Page 97 after line 5, insert. This is the A19 amendment.
To the amendment, Senator Murphy.
Thank you, Mr. President and members. I have spoken very briefly with Senator Benson about this amendment. This amendment deals with hospital closures and creating a process by which a hospital can move through a public process regarding closure. Hospitals, wherever they are in the state, are an important part of our communities. They are the place where people get care at the beginning and end of life and when they need surgery or inpatient care because they're very sick. Hospitals are important employers, and they are a part of the economic fabric of our communities. They are also the source of ancillary businesses like pharmacies and durable medical equipment companies that serve patients in the area. They also give a community a real sense of identity. I remember door knocking in Benson, Minnesota a number of years ago, and the person who came to the door to speak with me was worried about what would happen when their physician in that community retired, because if there wasn't a physician, would their hospital stay open, and what would happen to Benson, Minnesota if their hospital was no longer open? When I first began work in public policy many, many years ago, having practiced nursing both here and in a rural place in Wisconsin, our healthcare system was a system. It had a responsibility to the people in its care, to the communities, and to Minnesota. But over the number of years that I have been doing this work, I have watched our system migrate to become more of a marketplace where patients are told they are consumers, where people are expected to navigate a system that is meant to make money and has slowly but surely moved away from the commitment to individuals and communities and the priority of caregiving. We have seen now in Minnesota a number of hospital closures driven largely by market share and profit in different parts of the state. We are well familiar with the number of facility closures that happened in the southern part of the state under the Mayo Health System. We've seen clinics closing under the auspices of Health Partners, and most recently under Fairview, the Bethesda Hospital, and now St. Joseph's Hospital. That was a source, continues to be a source, but will no longer be a source of care for people with inpatient needs in mental health care. It takes a lot of work to open up a hospital under the law in Minnesota. You have to go through a public system and get the approval of the Department of Health. But to close requires almost none of that. And I think we're doing a disservice to Minnesotans who are counting on hospitals for many reasons, but primarily to get the care that they need when they are sick. I think it is time for us to create that process, and that's what this amendment does. This is the first time that I have offered this. It will be introduced as a bill, but it is work that I have been doing for some time. I do believe the Department of Health should have the ability to review, to ask about the economic impact of a hospital closure, to ask about the care impact, to ask about what happens to their employees and what happens to their work in their communities. I think these are important questions for Minnesotans to understand, and that is why I think this is an important piece of policy for our future discussion. But because it is the first time that we have seen it, because it is an important discussion that is going to require the voices and stakeholders of Minnesotans from across the state, most importantly, people who live in places where they don't have good access to health care because their hospital is closed, I'm going to withdraw this amendment. But I'm going to continue to work with this body and with Minnesotans to make sure that we have a balanced process to both open and close a hospital.